Namaskar and a very warm welcome to this edition of our program Question Hour, where we talk about gynecology queries. I'm Nidhi Kumar and you're watching India Science. Well, India's cumulative COVID-19 vaccination coverage exceeds 172 crores today. India reported 34,113 new COVID cases, more than 11 lakh vaccine doses administered in the last 24 hours. The recovery rate currently stands at 97.68%. As COVID-19 continues to worry us to a lesser extent in the country, COVID-related issues and queries are on the go. People are speculating about doses and its effects on various health verticals. In this program, where we take your questions from Facebook and YouTube Live, today we are joined by the very well known Dr. Suman Lal, Associate Director, Department of OBG, Max Healthcare, Gurgaon. Many thanks for joining us today, ma'am. Namaste.
Good afternoon,
And
Nidhi.
welcome to India Science. Yes.
Good
Please,
afternoon, Nidhi, and good afternoon, audience. Yeah,
I'd like to begin by asking you, tell our viewers about the general landscape gynecology scenario in India in view of the Omicron COVID-19 and new strains. How do you prioritize gynae management in such times? What are the specific protocols?
yeah. Nidhi, when we see of the Omicron, and it is the very mild infections, and we have seen so many women came in pregnancy with the Omicron, and they remain with the normal paracetamol and routine treatment, and they were very much well. The baby was also not suffered a lot. Therefore, I would say that the basic thing is that we should protect ourselves, keep the distancing as well as use the mask. But if the woman is catching the infection, not be panic. The infection is usually remain very mild, and protocol are the same. You should see your um, oxygen level and saturation level and see fever. If the fever persists after 5 days, then yes, you need to go for some other treatment. Like the lots of treatment has come in the protocol nowadays, like the antibodies, which are also safe in pregnancy, and other steroid which are also safe in pregnancy, but most of the time the woman doesn't need anything, and the baby can be delivered in the same time or at the later on, doesn't have the omicron infections, and baby remain very much well. So I think we should not be really worried about the Omicron in pregnancy as such. The treatment remains as they were non-pregnant, and baby usually will be taken care by the pediatrician. Only one thing we do once the woman comes in pregnancy with the Omicron, we have to keep the woman separated from the other pregnant women because they can transmit the infection. And if that subgroup, if the woman is having morbid obesity, heart disease, diabetes, uncontrolled disease, they can have the infections which has the poor outcome. So that is the only guidelines we say for the Omicron.
Thank you so much. We have several queries coming to us now, but before that, one question I'd like to ask and you to clarify. You just mentioned that it is not necessary for a pregnant mother to transmit the COVID-19 variant to its child, to her child,
Yeah.
or her, her offspring. So, how do you see that? This is normally the case, or sometimes it can be transmitted as well? Because you're saying you do keep her
Yes,
in a
the
separate chamber.
usually we keep the baby once the baby is out. The baby is keep with the other family member who is negative for the Omicron, and mother can feed the baby. At that time, mother will just wash her hands as well as change her clothes. She can feed the baby but wear the mask so that she will not transmit the infection to the baby. And once she will feed the baby, and baby can be handed over to the other person. So just usually we do the rooming in for the mother so that baby is nearby to the mother. But in Omicron infected pregnant women and after delivery, we keep the baby little away for 5 days or so, and after that baby can be kept with the mother.
All right. Doctor, could you please now tell us a little more about what are menstrual cycles, and could you explain for the benefit of the viewers what is a
Yeah.
normal menstrual cycle?
Yeah. Yeah. Is the normal menstruations? First of all, I would say it is the pride for the woman to start menstruations. Generally, in our society, we always say if the girl has started menstruations, what to do, this not to do. That is not good. Because if a girl started menstruations, it means she has got the feminine important aspect of her life. Therefore, menstruation should be taken as a normal, natural body process. The second important thing is the menstrual hygiene. Menstrual hygiene is very important because at the time of menstruations, if the girl are not keeping the menstrual hygiene properly, not changing the clothes properly, they can get the infections and which can lead to severe infections in the genital area and sometimes infertility as well. Therefore, use the washed clothes or the napkin, proper sanitary napkin. They should dispose the napkin properly. They should change the clothes at this frequent interval. These are the important aspect for the menstruation. Now coming to the menstrual cycle. Menstrual cycle is variable in every woman. Sometimes girls comes to us, okay, I had the period coming at the age or at the interval of 30 days. Now I am having the period coming at the 26 days. What abnormalities? But it is not abnormal. Generally, the women have the period at the interval of 23 to 33 days, we take as a normal period. And the flow, if they are having second, third day, little heavy bleeding, and first and fourth and fifth day or sixth day is normal bleeding or mild bleeding, that is taken as a normal. But if the woman who is having 5, 6, 7 days very heavy period, where they are passing clots and everything, then we say that yes, they are having heavy bleeding during period. They need to be evaluated. They need to be treated. Sometimes the women are having delayed period, like they are not having the period for 2 months or 3 months, then they are having the period for the long time. It means mostly they are having the hormonal imbalance in the body. Ovulation doesn't take place, therefore they are having these type of period. Again, they have to be seen for the PCOS or hormonal imbalance and needs some treatment for this. Sometimes girls are having the period coming at a very frequent interval. In that cases, we have to see that they are not having any other gynecological organic problem like the polyp, like cyst, like fibroid. That has to be seen and treated. And sometimes the women are having the bleeding comes off and on, like the irregularly they are having spotting or bleeding. That shows there's some organic problem, like the polyp in the uterus, cervix polyp, or some infection in the cervix, and very rarely they can have the cancer also. These women should go to the gynec. They should not feel that okay, I'm having menopause, therefore I'm having these type of bleeding. They should be evaluated, ultrasound to be done, and examination to be done, and should be treated properly.
Well, thank you so much, doctor. We have another question coming up on menstrual cramping. This is again from our YouTube. My menstrual camp, my menstrual cramping has increased so much since the last few months, and even I had to skip my office because of this pain. What should I do about these cramps?
Yeah. Uh, Menstrual cramping is very common in every woman. Sometimes in some cycle it is heavy, sometimes it is light. In some girl we have seen that they are having severe menstrual cramp from very beginning. That we say that is a primary dysmenorrhea. Causes are mostly not there, but they can be recovered after the childbirth or after marriage. But in the woman who is not having the menstrual cramp earlier, but now they are having the menstrual cramp, and which is increasing day by day, it means there's some problem in the uterus is there. Mostly we think that it may be endometriosis. Sometimes it is fibroid uterus or adenomyosis. These three diseases are not the cancerous but gives lots of suffering and needs the treatment as well. Therefore, if you are having the menstrual cramping, it is increasing and it has started nearby, started after childbirth, started after abortion, if started after cesarean, or if you are having endometriosis, fibroid, yes, it needs proper treatment because it may cause lots of suffering. Sometimes it increases so much every time woman has to come to the hospital. We give lots of injections and then they recover. Therefore, menstrual cramp is not to be taken lightly if it is started just after childbirth or if started after maturity. Means you have 30, 40 years and now you have started some sort of menstrual cramp.
All right, doctor. And I have been privy to the fact that a lot of people have agonizing menstrual cramps. So, very rightfully, you gave the directions. We have another YouTube question coming up. I have a lump in my
Yeah.
right underarm. It was there before the birth of my daughter, but post delivery, its size has increased. Is there any reason to worry about this? This is somebody called Shivam.
Yeah.
I think
Yeah,
this is
Shiva.
for his wife, yes.
Yeah. This basically whenever we have detected any lump near the breast, always we feel that is the breast cancer. It is not always true. Mostly in the axilla, in the right underarms, there is a breast tissues are lying there by genetic, means by birth. And when the pregnancy occurs, the breast tissues enlarges and this lump increases, and we can see this lump. After the childbirth and after feeding will be stops and breast tissue will reduce, but lump can be felt as a separate entity. Sometimes it happens that the women develop the fat in their body and therefore lump becomes more and more prominent, and therefore we have to go for the ultrasound to see that is the only breast tissues or any sort of fibroid or any sorts of breast lump which is dangerous. And if it is only the breast tissue, nothing to worry. But if sometimes girls feel that they are really bothering them because they can't wear the sleeveless or
Mm.
any other thing, they can go for to the plastic surgeon. It can be removed nicely and they can have their good shape in the underarms. So nothing to worry, but yes, it should be treated and it should be evaluated. Ultrasound is the answer for that. We can see what is the breast lump, it is fibroid or it is only mammary tissues.
Yes, doctor, but there is a sub question which the caller has asked, and
Right.
that is
Yeah.
saying that is it also because of feeding the baby that these kind of lumps do arise?
No, because whenever the breast tissues are there, then milk will increase the breast size. Then it will be a breast lump will be felt in the underarms and breast will increase. If the feeding will be there, the breast lump will never increase. Rather, if the woman who is not feeding the baby and the milk is retained there, there can be infections in those tissues. So the feeding will not cause increase in the breast lump. Nothing to be with the feeding is always be with the milk. Breast tissues increase in the size.
All right. Thank you so much. Another question that I need to ask you is what is PMS? Is there any treatment for PMS? If you could kindly explain PMS to our viewers.
PMS is lots of girls to lots of women are suffering with the PMS. What is the PMS? The premenstrual symptoms. Symptoms means you have the problem. What happened 10 to 15 days or 8 days before the period, some girls or some women are starting breast soreness. Breast size will increase. Some lump can be felt in the breast, which is painful. And sometimes they have mood swings. Some women are having severe depression as well. So these are called the premenstrual symptoms. Why this occur? It is because of the changes in the hormones in the second phase of the cycle. Means if you are having the period after 10 days, those hormones has been changed and therefore you are having these type of symptoms. In some women, the symptoms are much more, and in some girl where the breast has the fibroid, Fibroid becomes much more painful, much more enlarged. Therefore, they are having the breast lump, which is painful. When we talk about the treatment part, a treatment part depends on the what symptoms the girls or women are having. Sometimes they are having the breast lump, which is painful. We give the some painkiller, as well as we can give the vitamin E or some medicine to just decrease the tenderness and soreness in their breast. And after the period, the breast lump will decrease. We can go for the ultrasound even after the period to understand this is fibroid or fibrocystic disease of the breast or not. Second, the patients are having the mood swings. In those cases, or severe depression, in those cases, we have to add some antidepressant as well. Mostly, treatment has to be taken 3 months to 6 months, and after that, effect will be seen because most of the time, girls are taking the treatment for 1 month and then they come, we are not having any relief. Once you stop the treatment, maybe you can have the same problem later on. Then treatment can be restarted again. Mostly the vitamins, vitamin E and other medication doesn't have much effect on the body. One can take it for the long time. We have to give the antidepressant that we have to titrate accordingly. We can't say the antidepressant unnecessary to be taken for the long time. Most important thing is the reassurance for the woman because they should know it is the cyclic. Sometimes the women are in the irritable mood. We say that they should finish their the difficult task in the first 15 days of the cycle and keep their simple task in the next 15 days of the cycle so that they will not have panic attack and they will not be in the irritable mood. And family members should also be counseled because in the mood swings the family members has to suffer. Then we counsel them कि okay, it is because the hormonal imbalance, and they understand that things will be better for the women.
Well, another gynae query comes to us from Nisha on YouTube,
Yeah.
and she says, my sister suffers from severe pain in her abdomen during menstruation, and this has increased after she's given birth to her son. What is the remedy?
Uh, Again, we say that it is the secondary dysmenorrhea, means she had the pain during her period. That is called the dysmenorrhea, and she started after childbirth. We have seen the woman who is having childbirth, especially after cesarean, they can have this scar endometriosis or endometriosis, which can cause the severe pain. Sometimes they develop the fibroid and or polyp, which can also cause the severe pain. Therefore, you need to be investigated and you should go visit to the gynae and they can do the ultrasound, see the conditions, and depends upon the conditions or depends upon the diagnosis, you require the treatment. But in the meantime, you can take anti-NSAID like the painkiller you can take. But whenever you take the painkiller, better to take antacid. Otherwise, it can cause lots of acidity. Use the painkiller before you start the pain. If you are starting the painkiller after having severe pain, the relief will be very less. So better to take the painkiller and once you start the pain and in the lower part means if the intensity is much not very high, you start the painkiller. At the same time, painkiller has the life of 8 hours to 10 hours. The better to repeat your painkiller after 8 to 10 hours, and this will give you a relief. But yes, you should go to the gynec and get your tested also.
And interestingly, you just spoke about fibroids. My next question is on that, since you're also operating on a daily basis now. Are fibroids cancerous? This is a question that most women in India want to know. What to do if they develop a fibroid, like you know, cyst or something like that? What is the next step? Where do they go? Who do they see? And what are the tests that are done to, determine whether it is cancerous or not? Please tell us about the tests as well.
Uh, if we talk about the fibroid, in the olden time, our teacher used to say the woman who doesn't have the baby, they grow fibroid. It means it is so common in the women. and it can be seen mostly after the 40 years of the age. But yes, young women are also coming with the fibroid. If we talk about the origin why the fibroid occur, it can occur to any woman anytime. Therefore, we should not be worried that I have eaten something, it can cause the fibroid. I was moving here, it can cause the fibroid. It is not. Fibroid can occur in any woman anytime. It can be very small, it can be very large. But by most of the time, fibroid is not cancerous. That is the very good thing. Sometimes it is the cancerous fibroid that are the different thing like the myosarcoma, or these are the different entity. So as a gynecologist, how we can say that this is the looking fibroid which is cancerous and this is the fibroid which is not cancerous? Mostly it is very difficult to say unless we are biopsy the fibroid. But yes, the few symptoms can and few symptoms and few things can say us, okay, this fibroid look like cancerous and need the urgent investigation, urgent treatment. Like if the woman who is having fibroid for the long time and it is static or mildly increased with time, we say that most likely this fibroid is not cancerous. The second, the woman is having basic no symptoms, or they are having mild pain, they are having mild bleeding, but the fibroid is having the hardening, like the calcifications, or no much blood supply. Mostly the fibroid are not cancerous. That can be seen on the ultrasound. Mostly if the fibroid are multiple, like the 20 fibroid in a uterus, 10 fibroid in a uterus, the multiple fibroid or 5 fibroid in the uterus, mostly they are not cancerous. But if the single fibroid, which is vascular, which is causing irregular bleeding, which is increasing very fast, that always raise the suspicion of um, it is cancerous. Ultrasound MRI can help us in diagnosing, but 100% no one can say that it is fibroid or it is the cancerous fibroid. Now coming to the treatment. Again, I'll say not all fibroid need operation. Mostly if the woman who is unmarried coming with the fibroid having bleeding, we can give the medication. If she is not having any symptoms, no medication is required. If the girl who is infertile, they are coming with the fibroid, no symptoms. So generally we say that if you conceive, go with the fibroid, go with the conception. Fibroid surgery is not required for all the women who is having infertility. But in some women where they are not conceiving because of the fibroid, or we are going for the IVF treatment, there we go for surgical removal of the fibroid. In the perimenopausal age group women like the 40s to 50, they are having small fibroid, not having any problem. We say that after the menopause, fibroid will shrink in size. So there is no need for the any treatment per se in the fibroid. Just we can monitor by the ultrasound. It is not increasing in the size. But if the woman who is having symptoms, so what are the symptoms? Mostly the women are having heavy bleeding. Sometimes they are having severe pain. These are causing the problem. Sometimes the fibroid is coming in the cavity of the uterus. They cause infections. They need removal. So therefore, all the fibroid doesn't need the surgical treatment. Not all the fibroid need the treatment. Symptomatic fibroid need the medical medicine, and in some cases we have to go for the removal of fibroid. If the woman who is postmenopausal, she had ultrasound, no fibroid, but now she has gone a big fibroid, there's always the chance of having the cancer in that. Yes, these women require the removal of uterus or removal of fibroid, depends on the condition.
Yes, doctor. And you just mentioned fibroids may not always be cancerous. Agreed.
Yeah,
But the next question
mostly
is
they are not.
yes, and they're prevalent in the body. Like you said, a mushroom of such fibroids could
Yeah.
be seen in the uterus as well. What are ovarian cysts now? How are they different from fibroids, and do they have to be operated?
Yeah. Mostly people think that both are same, But in the uterus, we see that fibroid are solid tumor. And if we see the ovary and uterus are two different organs. Uterus is for the baby carrying, and ovary is for giving the hormones, giving the egg to the woman. And that is the organ we keep the woman young, and they can conceive because of the ovary, and uterus keep the baby inside. So when we come for the ovary may have the ovarian cyst. Now we are coming to the cyst. So many girls are having polycystic ovary, PCOD. They are saying that I have cyst in the ovary, I have cyst in the ovary, but that cyst is totally different in comparison to ovarian cyst, because polycystic ovary is the hormonal imbalance where we can see small cyst in the ovary. As soon as the hormonal imbalance will be decreasing from our body, they will disappear. And once the hormonal imbalance will recur in the body, they will reappear. They don't require any surgical treatment. We just treat the hormonal imbalance. Now coming to ovarian cyst. Ovarian cyst, like the women are coming with the 5 centimeter cyst, 10 centimeter cyst. Sometimes the ovarian cyst can cause torsion of the ovary, means the ovary can twist on the body. These are the cysts. 90% of the ovarian cysts in the young women are non-cancerous, but if they require the surgical treatment like the laparoscopic treatment, because they can cause the twisting, they can cause pain, they can cause hormonal problem. Sometimes they can be difficult in pregnancy. Therefore, we go for the ovarian cyst removal. 0.5 to 5% of the cyst, if they are in the ovary and remain for the longer time, they can cause the cancer. Therefore, if we feel that the ultrasound or MRI or blood test like CA125 is toward the cancer, we say that yes, urgently should go for removal of the cyst. But if the cysts are non-cancerous, they are less than 4 centimeter or 5 centimeter, they are not causing any problem, we say that okay, you can see, you can monitor, and you can decide about the treatment plan. Now coming to medical treatment for the ovarian cyst. People say that, ma'am, I can't take the medicine, I don't want to go for the surgical thing. Only the oral contraceptive pills are given in the ovarian cyst. They can reduce the functional cyst, means the cyst which is forming because the hormonal changes. But if the cyst which is organic, like the cancerous or non-cancerous, but because of some origin, generally pills will not change their size, not reduce their size. Therefore, gynecologists should see that what type of cyst it is. Accordingly, they should give the treatment plan.
Yes,
And
doctor.
when we talk about the recurrence of the ovarian cyst, the woman who has gone for the surgical thing of the ovary and ovarian cyst has been removed and they are coming again. If they are chocolate cysts like the endometrioma or the endometriosis cyst, 30% of the cysts recur. So therefore, once we go for the surgical treatment for those women, we always say there is high chance of a recurrence and you should go for the long-term preventive measures. So therefore, it's always understand what type of cyst it is. Sometimes the women are having the family history of the cancer and they have the ovarian cyst. We have the doubt that they can have the cancer in that ovary. In that cases, again we go for the several tests to find out it is cancerous or not cancerous. And in those cases, we generally think for surgical treatment in the little priority in comparison to young women coming with a normal 4-5 centimeter cyst.
Doctor, we're running out of time, but I need a short answer on this one. This has been flashing again and again. What is
Yeah,
IVF option and when should we choose it?
yeah. IVF is that once the woman couple are not conceiving, and we have seen all the reports where we can find out if they can't conceive by their own. We should go for the IVF option. Second is both the tubes in the female are blocked. Therefore, the sperm can't go in the tube to take the egg and make the embryo. Then we have to go for the IVF where the sperm and egg are separated, taken from the body and in test tube embryo is formed, which is inserted inside the womb. Third, if the male partner is having less sperm, in that cases we can take help of IVF, where the one sperm is transferred in the one egg, and it is called the ICSI, and one can have the good outcome, one can have the baby. Sometimes the male sperm is having abnormalities. The most of the sperm are normal. Then we can go for the IVF, where the selective sperm transfer can be done. Normal sperm can be transferred by the egg in the egg, and the embryo can be formed, it can be inserted. Sometimes the women are having the aging factor, hormonal factor like the PCOD. There the eggs are forming but ovulation are not occurring. We can go for the IVF, where the lots of eggs are formed and which is taken out, and it is met with the sperm and embryo can be transferred. Sometimes the woman is because of the aging and they form the embryo which is not good. In those cases, we can go for the IVF and add the PGS, where all the embryo are subjected from the chromosomal sampling, and whichever is having the normal chromosomes can be transferred in the uterus. The women who are having the genetic disease, or the male are having the genetic disease, we have identified the genetic disease. In those cases, we can go for the IVF and go for the PGD. PGD will know that which embryo is having the abnormalities, which embryo is not having abnormalities, and normal embryo can be transferred. So there are lots of indications where the IVF process is set by the gynecologist, and depends on your conditions, why you are not conceiving, and in that cases, you can take help of IVF treatment.
Absolutely, and that's real positive news for people having infertility issues, and I'm sure they'd love to hear this on India Science. Thank you so much. On this note, I'd like to thank you, Dr. Suman Lal, for joining us and sparing your valuable time. And with this is the wrap of this edition of Let's Talk Health Gynecology Queries on Question Hour. Until we meet again next week, please stay safe, keep that mask up. On that note, namaskar. Many thanks for watching. Stay tuned to India Science for all programs. Namaste.